All right, before we go to this next story, a warning that it contains sensitive video.
Maine Medical Center's emergency department staff say they are fed up with the violence in their workplace. Both nurses and department leaders say the department is taking care of people who need long-term mental health care.
Nurses have a list of demands, while Maine Medical Center management says it's committed on working on solutions. Here's News Center Maine's Chris Costa.
They finally turned around and said, you know what? You're right. We're going to give you some of what you want.
But things are not fine. Things are very far from fine.
We are being attacked by violent patients in the emergency room.
The patients just escalate and become more agitated and resort to violence more frequently.
Nurses at Maine Medical Center in Portland say they are assaulted on a daily basis, an uptick that started about 6 months ago.
We have been hit, bitten, choked, shoved, kicked, spit upon, and concussed.
Even the leaders of the hospital's emergency department recognize this issue, especially in the last 2 years.
And quite honestly, it's as bad as it's been in my 20+ years in medicine.
The hospital receives patients with autism and intellectual or developmental delays. Those patients stay for months because of a lack of beds, staff, and locations of dedicated mental health facilities.
Our healthcare team is being put in the worst possible position for a healthcare provider to be put in. It's not designed for care that stretches to days or weeks or months even, particularly for this patient population where we have little to offer. In these circumstances, the healthcare environment really does cease to be therapeutic.
Maine Med has 6 beds specifically for behavioral health patients. 3 of those have been filled by the same patients for weeks, leaders say. Those same leaders are now calling on the state to do more.
It has been quite some time that we've recognized that our behavioral health system was crumbling and that more needs to be done to invest in behavioral health and a continuum of services.
Nurses are asking for more staff. 2 nurses and 2 security guards for every assaultive patient. Management says they're working on that. Nurses have more demands, like isolating these violent patients.
But really the bottom line is if nurses are coming into work scared, nurses are coming into work not feeling safe, then how are patients supposed to have a safe place to heal?
That was Chris Costa reporting. Maine is getting a new, much-needed resource to help people struggling with mental health, and it's going right in the heart of Portland. Maine DHHS has announced a new crisis receiving center at 62 Elm Street.
The state says people experiencing a behavioral health crisis can receive expert care in a home-like environment. DHHS contracted with Spurwink to develop and implement the crisis center, which will soon be open 24/7. Right now, people can get help from 7 a.m. to 7 p.m. 7 days a week.